The rhythmic clicking of her artificial heart gives evidence of the medical miracle that saved Linda Epperson's life. But she says it's not the only thing that's keeping her going.
The nursing staff that is here is, I think, wonderful. I mean, they're the greatest. They do whatever it takes to keep me going.
Hey, Miss Epperson, how are you today?
It's a situation that Linda and every other patient in the country does not want to face. A hospital stay with fewer nurses. But that's just where we're headed.
It's a concern right now. And what we're doing in the healthcare industry is just looking and scanning right now to look into a kind of a crystal ball and say, what's the future going to look like if we don't do something right now? So right now, I think it's a manageable issue.
Why so many patients and so few nurses? Well, part of it boils down to demographics, specifically baby boomers. Many boomers in the healthcare field are now close to retiring. Factor in an aging population that needs more nursing care and fewer young people going into the field, and it's no wonder that many nurses are concerned about the future of their profession.
I'd like to see more people going into nursing, men and women. We definitely need more men in nursing.
And the nursing shortage is just part of the problem.
Nursing is not the only area where there's a shortage. There are many other health professions that have shortages, and we actually have put the call out. One particular strategy, it's called Mail Call, and where thousands of men were sent out invitations from high school students all the way up, and we actually ended up getting a number of individuals interested, including a former professional football player.
Other incentives? A higher pay scale, more opportunities for advancement, and the Nurse Reinvestment Act, the federal government's multi-million-dollar plan to attract more students to the field.
How does morphine stop chest pain?
I felt like it was a good way to serve, and I felt like I could help people, and I'm enjoying it. I'm enjoying school, and I think I'm going to be a good nurse.
Laura Russell spent some time in the business world and says nothing can compare to the opportunities found in nursing.
I can work anywhere, and since the 80s, the field has just expanded. I mean, you can't get bored. There's so many avenues to pursue.
The healthcare industry right now, as far as a job base goes, it's really solid. If you're looking for a job that you know that will be there in years to come, it's going to be in the healthcare industry because people are always going to need to be taken care of.
And ask just about anyone in the healthcare field whether they've just started the journey or they're handing over the reins. And they'll tell you it's more than a job or even a career.
I really like the sense of accomplishment. I like helping other people, just being there for the parents of these babies I take care of.
Knowing that I've helped people.
It's very rewarding to actually intervene on someone's behalf if they're facing a medical emergency, and you and the rest of the healthcare team are able to help them. There's nothing like it.
Any steps to ease the nursing shortage would be just what the doctor ordered for patients like Linda.
They're just like family. I mean, they're the greatest in the world. I would not be here if it was not for them. I really wouldn't.
For Smart Medicine, I'm Rod Starnes.
Joining me now is Dave Simcannon, Healthcare Employment Services Director. Dave, thanks so much for joining us.
Thank you for having me.
Tell me how local hospitals are being affected by the shortage.
We have an aging population, and those folks are out seeking health care advice, and are using services more. And really, even beyond that, there's a big emphasis on preventative care, which is taxing the system in terms of people accessing health care. And beyond that, we have a lot of workers who are approaching retirement age and looking at potentially getting out of the career field. And so those two things combined really have kind of put us in the situation we're in now, which is where we see the challenge and opportunity of trying to find qualified, competent healthcare workers.
So what are you doing? How are we getting all these new nurses?
Well, and that's a great question. And a lot of the local hospitals and areas have looked at various strategies on how we're going to do that. And part of what we've looked at is how we partner with the local schools and the regional schools. Because really, the goal is not to be stealing healthcare workers off each other. We need to increase the pool of eligible people as opposed to just trading people back and forth. So we've, various healthcare facilities have come up with partnerships with the University of Memphis, with the Baptist College, and the other schools around town that graduate nurses and other professionals.
What positions do you need filled most?
every position, to me, as an employment director, is important to fill. But I would say that the highest need areas, and you'll hear this again all over the country and all over, is going to be your nurses and your other allied health areas, which could be radiology and respiratory and rehab and laboratory. Those are the main areas I think that everyone around the country is finding the challenge in staffing.
We talked a little bit about how you're going about recruiting nurses and going to different schools. But you're also going to high schools as well, aren't you?
We absolutely are. We realize that we need to channel more students into healthcare, and rather than just waiting till they've made a decision in college to go into marketing or public relations or some other industry, we want to expose them to what healthcare has to offer in terms of benefits and opportunity.
Dave, thanks.